Hello, my name is Paul Friedman. I'm a heart rhythm doctor at Mayo Clinic in Rochester, Minnesota, and over the next few minutes we'll discuss standard pacemakers, leadless pacemakers, what they do, and how they're similar and different. A standard pacemaker has a pulse generator, or can, that's placed just under the collarbone. The can contains the electronics and the battery that's required to sense and pace heart rhythms. It then is connected to wires that we call leads that enter into the subclavian vein and travel down the vein to the heart, where the leads touch the heart to obtain electrical information and to deliver electrical pacing pulses. Pacemakers are used to treat slow heart rhythms. In the absence of a normal heartbeat, the pacemaker delivers a small impulse that reminds the heart muscle to contract, resulting in a normal heart rate. In this next image, we see an example of a leadless pacemaker. A leadless pacemaker is roughly the size of a bullet. That entire bullet-shaped device contains the battery and electronics and everything needed for the leadless pacemaker to operate. It's advanced from a vein in the leg into the heart, where it's then deployed, leaving only the small tip seen in the image. It will last anywhere from 10 to 15 years. This next slide shows a different kind of leadless pacemaker. In the top of this image, you can see a leadless pacemaker where tines, small wires, are used to keep it in place as opposed to the helix or screw. In the bottom left, you can see a different leadless pacemaker next to a European coin, which is roughly the size of a quarter. In the bottom right, you see X-rays with a leadless pacemaker in place. You notice in the center the outline or silhouette of the heart, and within it the small leadless pacemaker. There are advantages and disadvantages of each type of pacemaker. Approximately 15% of people who need pacemakers would be candidates for leadless pacemakers today, because the current leadless pacemakers are single-chamber pacemakers, that is, they only pace the ventricles or the heart's main pumps. Some people need dual-chamber pacemakers, or some even need pacemakers that can pace 3 chambers of the heart, so-called cardiac resynchronization pacemakers. Leadless pacemakers, for those individuals who are candidates, appear in early data to reduce the risk of complications by 40 to 50%. That's because there is no pocket, and thus no potential complications related to the pocket, which can include bleeding or infection related to the pocket, or lung collapse, which happens in approximately 1% of people when placing the wires into the vein, because the vein that the wires go into is right next to the lung. If that happens, then the lung collapse is treated with a tube between the ribs. Importantly, none of these pacemakers are defibrillators. A pacemaker gives a small impulse to treat slow heart rhythms. A defibrillator gives a shock to treat a rapid or chaotic heart rhythm. Currently, the leadless pacemakers are not used routinely with defibrillators, but in future it's anticipated that a kind of defibrillator that's placed just under the skin could communicate with a leadless pacemaker, thus allowing for a form of defibrillator that does not have long wires within the heart. Today, leadless pacemakers are not available routinely in the United States, but they are implanted as part of clinical research registries. However, they are currently undergoing evaluation by the United States Food and Drug Administration, and thus we may have them later this year. In Europe, they are currently available. It's been a pleasure speaking with you about pacemakers.